I am Dr. Lee. I am a neurosurgeon specializing in general neurosurgery as well as minimally invasive and complex spine surgery. I was actually born in Vietnam. I am a byproduct of the Vietnam War, actually. I am a boat refugee. I came in the late 70s, lived through one of the best decades of America, which I call the 80s. Got interested in neurosciences and did a lot of research at the National Institutes of Health, studying epilepsy, multiple sclerosis, retroviruses. I was actually in one of the labs that also discovered prion diseases. So that started in late high school through college, and then subsequently went to Brown for college, where I met my wife. I'm going to give her credit for convincing me to go into neurosurgery. And today we have 4 kids together. One of the best things that I have kept all through the years. After college, once I decided I wanted to go into neurosurgery, I eventually matched in University of Chicago. We had really good mentors that taught me, general neurosurgery, taking out brain tumors. We did a full year of pediatrics, did a lot of endoscopic brain surgeries, clipped quite a few aneurysms. But then I think towards the end, I had a chairman who specialized in minimally invasive spine surgery. And that kind of shifted my focus towards the spine more. And then I did an extra year of fellowship training at Stanford, where we did a lot of complex spine on top of everything else. And I think I kind of shifted most of my practice towards the spine aspect of it. So I do most of the minimally invasive and spine surgeries that need some thought into it. Yeah, the thing to know about minimally invasive spine surgery is that there's no back replacement. So even though we do back surgery, every back surgery actually weakens the back. And I think for the most part, 95% of back surgery is actually unpinching a nerve while trying not to make the back worse. So that's where the minimally invasive spine surgery comes in. It's the aspect of preserving as much of your natural spine as possible. So not disturbing the muscles, not disturbing the ligamentous attachment, leaving as much bone as we can. So it's all designed to unpinch the nerve, but not be as destructive to the back. When we have to do a fusion, where we have to put screws and rods in, think of it like leaving the sheetrock alone to put screws into the stud. The traditional surgery is more of removing the whole sheetrock to do the surgery. So that can, in the long term, weaken the back more. So some patients don't realize it right away, but several years later, they'll have more back pain. So the concept of minimally invasive spine surgery is to try as much to preserve as much of the back that the patient has and not make it weaker while we try to unpinch the nerve at the same time. So when I was young, very active in tennis, violin, but nowadays I think as the joints creak a little bit more, I actually enjoy more landscaping, gardening, bird watching, wildlife, a little more slow-paced activities. And I think my wife likes them too, so it gives us both a hobby to kind of enjoy together. I think what's special about Rebound is that we work as a group. For the most part, we don't fight for patients. Patients will go to the best doctor with the special skill that's needed for treatment. And I think we all do things very ethically, and patients actually get the recommendation that we would give our family, loved ones. Some patients, we actually don't want to have the treatment as surgery. So there's a lot of patients that actually don't need surgery, and as long as the patient can get better, that's the best outcome we want to give the patients. If it requires surgery, we will try to design a surgery that gives you the best outcome with the lowest risk. But if it's a surgery that will make you worse or is not beneficial, we would not offer that to patients. So I think the monetary incentive at Rebound is a lot less than the responsibility to the patients. And I think that's what set us apart. We're a group that works well together. All of us together have fairly diverse skills that will cover pretty much any pathology that hits the door. And as a group, we actually always have a specialist that can take care of the problem that comes to us. So neurosurgery can be very challenging, and a lot of times we do make life and death decisions. We cover call, and there's a lot of unknowns that go through the ER. I think in my early years, there was young kids that had a lot of brain hemorrhage. One had an AVM, and I remember operating very late at night to take the AVM out. And it was a very touching story that he survived, and he had a son, the same age as my son. And in the early years, he would write letters to me to let me know how his son was doing and how he was doing. And despite the devastating injury, he was so glad to be alive and given a chance to see his son grow up. And it was pretty touching because our sons are pretty much similar age. To me, that was very memorable because it could have gone the opposite way. There's also a lot of other things that, even though not life-threatening, spine and pinched nerves cause severe disability, and patients are in pain all their lives, and it affects, how they function and how they relate to people. And some of them have pain for years. And a lot of times it's very gratifying that a couple of hours of my time identifying why they're hurting can be a life changer for them. And I think there's been quite a few patients that have acknowledged that some of the surgery, when they see me back, have been life-changing for them. And that's also very gratifying to hear that, all the training that we put in through it, we were able to have an outcome that is life-changing for a lot of these patients. So I think that aspect is very rewarding.